talk about care management. You've got hospitals. Historically, they've been working simply in the middle of the acute care hospital side. Post-acute, if we go to the right, post-acute and home and physicians onto the left side. Those are really, from the accountable care organization perspective, it's really looking at the whole continuum. Here's another diagram, fee-for-service. That's what we're all used to currently. The CMS pays the hospital, or they pay the anesthesiologist, they pay the hospitalists, they pay Milwaukee Catholic Home. When we get into bundled payments over the next several years, really that payment is going to be at risk between a number of different groups here. For example, typical Medicare payment is $17,000. You've got a bundle where you're going to be paid. The hospital is going to be at risk for the $16,000. $9,000 of that cost will be the subacute or Milwaukee Catholic Home in your TCF. You've got your hospitalists, your doctors, your medical equipment, basically $14,775. So you'll be able to share in that cost savings of roughly $1,000. Where you're at risk now is if that readmission, if that goes back and that cost of that care goes over that $16,000. Bundled payment, you're looking at that being implemented in 2018. Again, we're seeing that happening today. Client we're working with in Pennsylvania. We just signed contracts 2 weeks ago on their bundles, where the hospital is going to pay a certain amount of money, and we've got to be able to work within that aspect. And it's creating a lot of headaches and a lot of work that's needing to be done in order to be able to track those costs. One of the biggest pieces is long-term care providers typically have not tracked what it costs in order to provide that care. Through a couple of here because we are literally at 5 minutes here. I know there was a slide, Dave, that you and I. Let's see here. Let's talk about the future. We talked earlier. We know that acute hospital usage will go down. We know that the remaining volume is going to be spread across fewer providers. Referrals will not be sent to any willing provider. We talked about the clinically integrated platforms that we need to be really looking at, and that ACOs, hospitals, MCOs are really looking at what partners they can work with. Bundled payments will be coming. Demand for traditional institutional long-term care will continue to decline. And that capacity to manage risk in the future will be key for bundles and other areas of care. So really when we look, we're really going to need to integrate with our hospitals, our docs. You're seeing that happening with CSM, with their hospitalists. Improved communication, electronic health records, direct relationships with joint operating committees, and I'm sure you've been invited to some of these meetings that have been happening in the Milwaukee area. Developing these clinical pathways, congestive heart failure, pneumonia, and really being able to care for those people that the hospitals want to be sure that when they discharge that they're not going to get them back in a readmission. Intervening is really, are we addressing these readmission issues? There are several operations like Interact, for example, that are really working in a lot of skilled nursing facilities on managing that whole hospital readmission process. And innovating new models of care. Again, we're going to need to be able to provide different types of services than we have historically. Four areas of focus. You need to understand where do you want to be, where do you want to go. Stay informed about what's happening in your local market. Seek out collaborations and partnerships. You know, you're working with CSM. And most importantly, you really need to have an understanding of your operational platform on what your cost structures are, and which is really something that long-term care providers historically have not been very good at. All right. I know there was a lot of information there in the last 20 minutes. Any questions? So there you have it.
And just, I think everybody's aware of this, but the strategic planning committee has started. I think we had our first meeting on this. In fact, Mr. Schneider's here. Greg Schneider's in the back of the room. He's going to be the facilitator working with the board as we move through strategic planning. Our goal is, I would say, over the next 12 months to understand more clearly some of the minutia of this. But the board is charged with creating that vision with senior management, but then it's our job to execute on it. So this is the first of many opportunities for this team to get together and understand what the board is grappling with. I'd like to see this process be two-way as opposed to a one-way. So this is just the beginning. So please, input is invaluable. You're going to see some of the things we're doing, especially with electronic medical records in 2014. We've asked nurse management to be involved in this. I can't emphasize enough how important that is. This needs to be a collaborative model, and everything's on the table as it relates to EMRs, because that is a huge infrastructure piece that needs to be developed in this year for implementation in 2015. Thanks, Tim.
Yes.
One more, Tim. The economic collapse of the previous years, what has that done to this market?
Well, I mean, there was a period a couple years ago where occupancy levels really suffered, especially on the entrance fee communities and independent living communities. But I think we're working our way out of that.
Father Chuck, the living example is Newcastle.
Yeah.
They overdeveloped.
Absolutely.
We had an economic meltdown. They weren't structurally sound. They dissolved. The marketplace said, sure, we'll buy you back at about 30 cents on the dollar.
Right.
So what happened is the market self-corrected.
But you do see us coming back?
I want to make it, I'm going to answer that, Chuck. We are back. The Catholic home has come out of this stronger than we were 6 years ago. It may not appear that on the surface, but we are. The good news is we came out in the game. The bad news for our nonprofit provider next door, they did, along with a number of other providers, you can name them up and down the east side here, that closed over the last 8 to 10 years. It's an amazing number.
All right, Dave's got electronic copies of everything we've got here, and we did move very quickly through that last portion, but we just really wanted to get that out there.
Thank you.